Welcome, everybody. Welcome to our dementia workshop, Dementia Conversations. I'm Eric Rohr. I'm the owner of Assisting Hands here in Richmond, Virginia. We're a home care agency where we help people remain in their homes and help them with their activities of daily living. And we also, one of our big focuses is on dementia and care for people living with dementia and providing respite support for those family members that are taking care of loved ones with dementia. We're really excited that you joined us here today. Some of you may be a little bit confused by this. We had a workshop earlier today and we forgot to record it. So we're going to go ahead and record this workshop for you all. And it'll all be the same content for any of you that did join us live. We're really excited to partner with Brookdale Senior Living. We have come up with a series of these workshops. We're calling them the Second Thursdays. So this is the fourth workshop we've had. And we're going to have, after today, we'll have 3 more. And we're really excited to be working with Brookdale and Brooke Brockdorf over at Brookdale. They are a wonderful assisted living and memory care community in Midlothian, Virginia, not too far from here where our Assisting Hands offices are. And they're as dedicated to dementia awareness and education as we are. And we're really happy to be bringing all these conversations and all these workshops to you. I'm really excited to introduce Cathy Hamlin. Cathy is the executive administrator of Assisting Hands Richmond. And she's a certified dementia practitioner. She has been certified by the Teepa Snow organization, which is called the Positive Approach to Care. And she's one of the very few in the Richmond area that is certified in Teepa Snow's kind of approach to dementia care. Cathy is also, amongst many other things, a certified HR professional, and just a wonderful person, and I'm glad she's my executive administrator. With that, I'm going to turn it over to Cathy, and we will take it from here. Thanks again for joining us today.
Thanks, Eric. I really appreciate that great intro. Today, we want to talk about our workshop goals. We'll go over a brief overview of dementia. We'll identify some strategies to have a successful conversation, learn specific conversation techniques around the following topics: going to the doctor, driving, and financial matters. And then we'll also give you some dementia resource identification. Overview of dementia. We've been over this a couple of times, but just to refresh your mind, dementia is the umbrella term for a person's decline in memory and other cognitive abilities that is severe enough to interfere with their daily life. It is not a normal part of aging. It's estimated that approximately 50 million people worldwide, with 5 million of them living in the United States, are currently living with dementia. This number will almost double every 20 years due to the extensive research that's being done with dementia today. There are 4 truths that you need to remember about dementia. At least 2 parts of the brain are dying. It keeps changing and getting worse, which makes it progressive. It is not curable or fixable, and it does result in death. While you may have some underlying health issues that could affect your end of life, dementia will definitely result in death. There are 4 main types of dementia, even though there are about 60 different types out there now, but the 4 that people are most familiar with are Alzheimer's, dementia with Lewy bodies, vascular dementia, and frontotemporal dementia. There are a lot of causes and risk factors. There are a lot of common symptoms of dementia, but everybody needs to remember that Alzheimer's accounts for about 60 to 80% of dementia cases, but many other dementias can affect cognition. Frontotemporal dementia, for example, tends to affect behavior before it affects your memory, while primary progressive aphasia attacks speech and language. Of course, your doctor may not know a patient's exact dementia diagnosis because the symptoms of different dementias can overlap. And sometimes a precise diagnosis is difficult or impossible to make in the beginning. Although dementia is chronic and untreatable, there are some treatable medical conditions that merely mimic them. For example, severe depression can cause many of these same symptoms. Do not assume that changes in personality or memory loss mean that a person has dementia or that the condition is untreatable. Seek medical care as early as possible. There's no way to predict the course of dementia. Some people will remain relatively independent for years, while others will quickly spiral into poor health. Knowing how severe the dementia is can help you plan for the future and anticipate looming needs. Your family physician can identify a number of issues that commonly crop up in dementia patients. He may notice confusion. You may notice frustration or agitation, particularly in the evening, as well as depression. On the physical side, your loved one may lose the ability to control their bodily functions and can be vulnerable to urinary tract infections. Those with severe dementia may have trouble chewing or swallowing, while changes in their depth perception can make patients more vulnerable to falls. Structuring, in our last workshop, we discussed effective communication strategies. And now let's talk about how to structure a successful conversation. Considering that dementia will get worse with time, people with dementia will gradually have a more difficult time understanding others as well as communicating in general. So you want to make sure that you create a positive conversation environment. Avoid distractions, speak clearly and naturally in a warm and calm voice, listen actively and don't quibble. Always refer to the person living with dementia by their name instead of hey you or mom or dad. Call their names. You may have to use nonverbal cues such as notes, hand gestures, facial gestures, anything to keep their attention. And have patience and understand that there are going to be good days and there are going to be bad days. You want to have these conversations as early in the stages of the disease as possible. Understanding how difficult these conversations can be for both you and the person living with dementia. You might want to ask your loved one if he or she would like to know if you notice any changes. You definitely want to practice your conversation in advance and talk when both of you are relaxed and comfortable. Do not focus on the fears or the changes that the behaviors are causing. And please don't make the person living with dementia feel guilty or afraid. We'll start our conversations with going to the doctor. There could be a lot of fear, anger, and stigma attached to these doctor's appointments, but it's really important to get a diagnosis, to keep up with regular checkups, and to always seek medical help. Oftentimes, going to the doctor, elderly parents don't want to burden their children with their ailments. This is why adult children need to voice their worry and concerns by making the issues their issues. When you're talking to your loved one about their mental health, it's just plain uncomfortable. So how do you explain your concerns to the doctor without embarrassing your loved one? How do you let them maintain some respect? What do you do if your loved one strongly denies there's a problem? And how do you get them to go to the doctor in the first place? Well, what you should say is, I worry about you, and seeing what the doctor says would make me feel better. I would rest easier knowing that we have the most up-to-date information about your health. Caregivers struggle with what to tell their loved ones about the doctor visit. It's all in how you prepare them that can make the difference. Treat it like just another preventative medicine visit, like a colonoscopy or bone density testing. Just tell them that they're going for a brain checkup. You might want to use words that are most comfortable for the person. Medicare has a free annual wellness visit. That might be a good way to get them to go. Pair an enjoyable outing with the doctor's visit, maybe lunch, a visit to the park, or even shopping for the afternoon. You may want to invite other family members to communicate their questions for the doctor. And if your loved one is still reluctant, try using a therapeutic fib. There are lots of things to happen when you're going to the doctor. You want to contact the doctor before routine checkups, just to let them know that you have some concerns that you'd like to talk about. You might want to write your concerns down, either call or write the doctor in advance to prepare him for the visit. You want to get together a list of meds. You want to write down examples of the changes you've noticed and go ahead and make a list of questions that you feel like you need to ask the doctor. When you're trying to set the tone for showing respect to your loved one, let them know that we're here to see if the doctor can help them keep their memory for the next 10 to 20 years. Then always ask the patient if you have their permission to talk to their doctor about what you have observed. You want to revisit with the doctor all documents that assist with future decision-making and care. And these documents could include a privacy release from the doctor's office that indicates who can discuss diagnosis, treatment, and other medical concerns. You may want to have a durable power of attorney for healthcare, which designates who can make medical decisions when the person with dementia is no longer able to do that. And there may be an advance directive that enables a person to make their own decisions about future care. Be ready to ask and answer questions. Keep a list of changes that you see in memory, behaviors, or moods. Try to make notes of times of day or types of experiences that are challenging and those that are positive. And before the appointment, write down any questions you have regarding symptoms and behaviors. Take notes. It's really important. If you don't understand something the doctor tells you, ask for clarification. They may want to change medicines or adjust dosage of medicines. So always make sure that you're aware of the following: the name of the drug, instructions for taking this particular drug, the reason for taking it or for adjusting the dosage, any possible side effects, and instructions for when to call the doctor or when to stop taking this medication. You want to discuss future care, long-term and short-term. Over the course of this disease, treatment goals are going to change. Discuss with your doctor expected care levels needed in the short-term and long-term, and these decisions and discussions could include plans for driving, the need for supervision or adult daycare services, memory care centers, nursing home care, palliative care, or even hospice care. Discuss end-of-life preferences with your doctor. He or she can explain what health decisions you may have to make in the future and what treatment options are available. Talking with your doctor can help ensure that your wishes are honored. Then always ask for recommendations if you need to ask for help. The doctor can refer you to various community resources, and some clinics and hospitals may have a social worker available to help identify and arrange support services. Leave with a plan. Write down any instructions or tasks that need to be addressed between now and the next appointment, including any appointments for tests or tests that need to be scheduled, details about changes in treatment and care, concerns about instructions to share with other caregivers, and behavioral or changes in signs or symptoms to watch out for. Dementia can be a terrifying diagnosis, especially when you do not know what to expect. However, it doesn't have to be dark and a mysterious force haunting every second of your loved one's life. There is still plenty of joy to be found after a dementia diagnosis. Having the right medical information can help you or your loved one plan for the future, choose palliative care options, and pursue the right treatment. Keep it positive. Don't focus on their deficits. Acknowledge the fear. It's normal to be worried and fearful when you suspect something is wrong with your mind and your everyday abilities. Be persistent, always persist gently, and never respond with anger. And throughout any discussion, work to keep your loved one as involved as possible to give them some control. I think, to me, one of the hardest conversations you'll have is when to tell your loved one to stop driving. They may be having accidents, scrapes, making mistakes, driving too slowly, driving hazardly, or other questionable activities. Although you may want to avoid dealing with the often sensitive topic of driving, you need to know the signs that would suggest that your parent or loved one can no longer drive safely. Learn what steps you can take if your loved one is in danger on the road but refuses to stop driving. A person with dementia may perceive giving up driving as a loss of independence, and deciding not to drive means accepting one's abilities or changing. To help a person with decisions about driving, begin the conversation as soon as possible and involve the doctor if necessary. Involve the person living with dementia in the planning and decision-making. Talk about the safety of the driver and others. Appeal to their sense of responsibility, but be aware of their person's feelings about this particular change. Some of the behavioral signs that we need to look at are loss of coordination, difficulty in judging distance. Do they get lost or disoriented in very familiar places? Increased memory loss, difficulty with decision-making and problem solving. Some of the poor driving signs are they're driving too slowly, they stop in traffic for no reason, they ignore traffic signs, they don't have good judgment, they don't see well enough and have the potential to hit pedestrians, objects, or other vehicles. These signs will be most noticeable to family and friends who have interacted with the individual over time. People with mild dementia are at a much greater risk of driving unsafely compared with people of the same age without dementia. Some people with dementia may decide that they no longer want to drive because they're concerned about the safety of others. Some may be reluctant to stop driving and they may not be aware of a decline in their driving skills. If the individual with mild dementia has not shown signs of unsafe driving and would like to continue to drive, your physician may recommend a roadside driving evaluation by a professional. Ask them to be your co-pilot. Ask for specific instructions about using turn signals, changing lanes, following the rules of the road. Ask them for specific directions to somewhere where they are very, very familiar. Look for their frustration and the ability and the capability to stay focused. If he or she is easily frustrated or loses their focus regularly, it might be time for an independent driving evaluation. Virginia has no laws against driving with dementia specifically, but obviously they have laws about medical conditions which impact a person's ability to drive safely. Doctors may report a potentially unsafe driver, but not required to do so. If it is reported to the DMV, then Virginia has a cognitive impairment policy. It is the policy of the DMV, based on guidance and recommendations from the Medical Advisory Board, that drivers with a diagnosis of cognitive impairment of any severity that may affect their ability to drive, or a diagnosis of dementia of any type They must successfully pass the DMV knowledge test and then the DMV skills test. This policy was established in order to address the concern that drivers with any type of a condition resulting in memory loss and impairment in cognition, reasoning, and/or judgment may have days when they are lucid and they may have days when they're confused. The DMV reserves the right to request that a driver provide additional information from a specialist in order to determine the severity of the condition and to assess their ability to safely operate a motor vehicle. You want to encourage driving on familiar places. Make sure that they are avoiding long, heavy traffic, heavily traveled roads. Avoid driving at night and in bad weather. You want to look for alternatives to driving and to begin to use them as soon as possible. Even if the person with mild dementia is still driving, you can begin the transition to other transportation options. These could include having family members and friends provide transportation for errands or appointments. There are a lot of delivery services out there now that can bring groceries and their medication. Most cities have senior transportation services. Other transportation could be offered by community centers, houses of worship, and other organizations. And then there's always the taxi, Uber, or Lyft. When to stop driving? Here's some tips for you. If the person living with dementia has accidents or they're driving erratically, please plan ahead before the accident occurs. Express your concern about the specific changes that you have noticed. Appeal to their sense of responsibility and concern for others. Incorporate the voice of an esteemed professional, but most of all, have empathy. Driving is very important to older people. It is really their only connection with maintaining their independence, and taking away their driver's license, their driving privileges can really affect their dementia. It's important to maintain that independence and respect, but really you have to put safety first. You may end up hiding the car keys. You may end up replacing the keys with the set that will not start the car. You may have to disable the car or sell it. You can control key access. If the person with dementia wants to keep keys, offer them some that don't work. Disable the vehicle by removing a battery cable to prevent the car from starting, or ask your mechanic to install a kill switch that must be engaged before the car will start. And then you might have to sell it, but move the car out of sight. Again, out of sight, out of mind.
You know, Cathy, I think this is, one of the things that was hardest for watching my grandfather go through this with my dad having tried to manage that. And I think that one of the best tips I hear is the co-piloting. And you drive, the person that may have dementia is the co-pilot, and make them give you detailed instructions. And that'll tell you a lot. And I think that process also may help them come to a realization that they're not as, cognitive or sharp on what to do. If they're sitting at a crossroads for longer than what you normally would do, that may be a signal. And I think that's kind of important. And I think the other thing is, you really don't, we're all worried about their well-being. They don't get hurt in an accident, but I think everybody would agree that, if they were to cause an accident and hurt somebody else, that would be devastating to their probably emotional and mental health. And it's already fragile to begin with. So I think this is probably, of the three topics we're talking about, driving is probably the most difficult one because it's such a tangible sign of independence or lack thereof. And so I think that it's a difficult one, and it takes, I think, have empathy is probably the most important one, because while it may be logical to you and you may see it, it's going to take them a little while to kind of come to grips with it. So
Absolutely. Now, the next tough conversation that you'll need to have will be about legal and financial decisions. You're probably going to feel very reluctant to have this conversation. It will be uncomfortable. It may seem intrusive and disrespectful, but we still need to take time to have these conversations. It's the most kind, thoughtful, and loving thing you can do for the person living with dementia is to be honest with them. While legal and financial decisions are a touchy subject to most, having these conversations early allows you to connect and enjoy your time together now and in the future. So you're going to want to plan and review regularly over time important documents and papers. Where are they? Who has them? And update them as needed. Who is going to make these healthcare and/or financial decisions when the person living with dementia is no longer able to do so? Getting their wishes down on paper means that they'll be preserved and respected by all members of the family. You'll want to consider power of attorney for both finances and for healthcare. And if the person has already lost their capacity, you may need to go to court and apply for a guardianship or a conservatorship. Review your plans over time. There's a lot of changes in personal situations, such as divorce, relocation, or death in the family. And in some states, laws can affect how legal documents are prepared and maintained. So review them regularly and update the documents as needed. You also need to determine how healthcare needs are going to be met. Sometimes family members assume that a spouse or the nearest family member can take on caregiving, but that's not always the case. Caregiving is a major commitment that gets bigger over time. Family members may have their own health issues, jobs, and responsibilities. So communication is essential to make sure that the needs of the person living with dementia are met and that the caregiver has the support needed to meet those needs. You want to start discussions early. The rate of decline differs for each person with dementia, and his or her ability to be involved in the planning will also decline over time. Break the conversation into parts. You may have to have several conversations at different times and different locations. Try to avoid having these conversations by telephone. It's much easier to do them in person. And don't feel like everything has to be done today. Again, it may take several conversations to get everything in order. You may have to talk about financial documents one time, legal documents another. And sometimes it may be easier to start these conversations having lunch or during a dinner outing. You always need to make sure that you review your plans regularly and update your documents as needed. Put your important papers and copies of legal documents in one place and tell a trusted family member or friend where you put all of your important papers. And plan for the future. No one ever plans to be sick or disabled. This is the kind of planning that can make all the difference in the world as the dementia progresses. You want to involve mothers, fathers, sisters, brothers, and other families to help make these decisions. Sometimes you might have to pool your resources together to ensure that care can be provided for and expenses can be paid. And it's very important to help the person living with dementia understand why their financial position is so important. It's so the family can help make the best long-term care decisions for their loved ones. You want to connect with your loved one and having these conversations and tell them, we are in this together and we need to have a plan in place. And reassure the person living with dementia that you will always be a part of the process now and in the future. You want to ask the questions rather than telling the person living with dementia what needs to be done. You want to ask, what documents do you have in place? Where are they? Who has copies and who should have copies? And who should review them and how often? You want to gather all of your documents, including banking information, insurance, life insurance, titles, and deeds. Do any of them need updating? Are there any other documents that need to be completed at this time? And here are some of the documents that really will come into play for you. Some of these will be not invalid in other states. So this is done specifically for the state of Virginia. You might want to have a living will. This describes and instructs how the person wants their end-of-life healthcare managed. And some people, instead of a living will have utilized the 5 wishes to make these decisions. You should have a durable power of attorney for healthcare. And it doesn't have to be the same person that's a durable power of attorney for finances. But the healthcare power of attorney will have the authority to make healthcare decisions on the behalf of the person living with dementia when they are no longer able to do it for themselves. If you have a DNR or do not resuscitate order, this instructs healthcare professionals not to perform CPR in case of a stopped heart or stopped breathing. But it's very, very important that your doctor have a copy of this DNR and that the DNR needs to be posted in the home. If emergency medical services are contacted and you cannot produce this DNR, then they will go ahead and provide CPR and help with any issues like that and get people to the hospital. Then when it comes to legal issues, a will is always recommended because this is going to determine how a person's assets and their estate will be distributed among the beneficiaries after his or her death. There should be a durable power of attorney for finances because someone is going to need the authority to make legal and financial decisions on behalf of the person with dementia. And then there's living trusts. This gives a designated person or the trustee the authority to hold and distribute property and funds for the person with dementia. But make sure that the person designated in these forms is trustworthy and honest. It's very easy to take advantage of a person living with dementia. Caregivers should be trained to look for signs of financial abuse. This is one of the areas that hits people living with dementia and other elders. It's very impactful. Here at Assisting Hands, our care staff and we, and those at Brookdale with Brooke, we are considered mandated reporters here in the state of Virginia, which means if we see abuse happening, we have to report it. And if we don't report it, then we're just as guilty as the person doing the abuse. And then finally,
real quick, Cathy, before you go on to the next one, I just will say for this section on the legal and financial decisions, I think it's even more important that, you know, per what you were saying, thing is be proactive on this. The longer you wait, the harder it gets, because this is definitely an area where the person living with dementia has a lot of information that they know about, details about insurance policies, assets, bank accounts, debt, ownership, etc. And it may not be organized. And if they now lose the ability to explain that, it could be a mess for everybody to deal with. So this should be a process that should start earlier rather than later. The other thing is, I think a lot of times people feel like the default is to make their spouse the, you know, person that is responsible. And that is a very, rational decision. But if your spouse can also, if they start declining, you may have missed an opportunity to actually have somebody else involved. And so I think this is where openness and conversation is necessary, and being proactive on this before, this should be happening even before dementia sets in, and all this stuff can be structured so it kicks in when it's necessary and not before then. One other thing is, Cathy nor I are attorneys. So, I think these are just general guidelines. These are things best to consult an attorney or some other legal expert on, but these are very standard type of documents that we run across. And so anyway, that's what I wanted to say before we moved on to the final thoughts.
Okay. And finally, don't forget about yourself. Ask the doctor if he or she can refer you to a dementia support group, because this is very challenging. It's work that demands ongoing commitment. It is a marathon, it's not a sprint, and that means you have to take care of yourself. Prioritize self-care and accept help whenever available. If you experience signs of caregiver stress, depression, or anxiety, seek help from a doctor or a therapist. These are certainly treatable conditions, and getting the right support can help you sustain the energy that providing care demands. You want to prepare for the road ahead. The more you learn about your loved one's disease and how it will progress over the years, the better you'll be able to prepare for the future challenges and reduce your frustration and foster reasonable expectations. When you have a personal support plan, you're balancing the enormous task of caring for a cognitively impaired adult with your other responsibilities, and that requires skill, attention, and meticulous planning. By focusing diligently on your loved one's needs, it's easy to fall into the trap of neglecting your own welfare. If you're not getting the physical and emotional support that you need, you're not able to provide the best level of care for your loved one, and you face becoming overwhelmed, and they will get incredibly frustrated. So you also need to be able to cope with the changes in communication. As your loved one's dementia progresses, you'll notice changes in the way they communicate. They may have trouble finding words. They may be using increased hand gestures, easily confused, even inappropriate outbursts are normal. You need to avoid becoming frustrated by empathizing and remembering that your loved one can't help their condition. Making them feel safe rather than stressed will make communication easier. If you feel like you're getting to the end of your fuse, it's okay to take a break. Having day-to-day routines in dementia care helps caregiving run smoothly. These routines won't be set in stone, but they can give a sense of consistency, which is beneficial to your loved one, even if they can't communicate it. You'll also run into some problem behaviors. One of the major challenges of caring for a loved one with Alzheimer's or another dementia is coping with the troubling behavior and the personality changes that often occur. These behaviors could include aggressiveness, wandering, hallucinations, and eating or sleeping difficulties that can be distressing to witness and can make your role as a caregiver even more difficult. Often these behavioral issues are triggered by your loved one's inability to deal with stress, their frustrated attempts to communicate, or their environment. You can make some simple changes that can help ease your loved one's stress and improve their well-being, along with your own caregiving experience. And you want to make time for reflection to help with acceptance. And what this This is one of the biggest challenges a caregiver for someone with dementia has to accept what is happening to your loved one. At each new stage of the disease, you have to alter your expectations about what your loved one is capable of. By accepting each new reality and taking time to reflect on these changes, you can better cope with the emotional loss and deepen the feelings of satisfaction in your caregiving role. And always remember, if a friend or family member asks if they can help you out, the correct answer is almost always yes. You know, we're told as growing up that it takes a village to raise a child. It also takes a village to care for someone living with dementia. And our final thoughts are talk about it. Remember, no one person can provide all of this support alone. Here's some dementia resources that we'd like to make sure that you're aware of. The first and foremost is my mentor, Teepa Snow. She has a positive approach to care. There are a lot of free things that are available to caregivers. She does blogs. She has a Facebook Live every day, morning and evening, that are free to the public. It's a great avenue for you to ask Teepa your questions and get an answer directly from her. We also suggest that you might want to go to AARP of Virginia. They also have some very great tools and things that can help with caregiving, can help relieve the stress in general. Then there's always DARS, which is the Virginia Department for Aging and Rehabilitative Services. George Worthington is a great person there. He always has an open door policy, and he's more than willing to answer and help with any questions or concerns. And then always the Alzheimer's Association. Marie Calindo, who is the executive director of the Richmond chapter, also is an awesome resource for people. She indeed too has an open door policy and is always willing to talk to anyone about the care that they need to provide for their loved ones. And then you have us, Assisting Hands Home Care. We do have dementia as one of our core competencies, and we do train all of our caregivers in all types of dementia. So when they go into the home, they can offer the family members support, they can provide the correct amount of care, they can redirect, and they can be a resource for you so that you can be relatively calm and know that your loved one is being taken care of and that your loved one can remain happy and healthy in their own home. And then we also partner with Brookdale and Midlothian. They have a tremendous memory support center there. They are also training their staff in the positive approach to care. And Brooke, who is their sales representative, is always available to answer questions about their particular community and the assistance and help that they can offer. And then remember, we have our second Thursdays, our dementia workshop series. Our next workshop will be understanding and responding to dementia related behaviors. And you can see we've kind of gone in kind of order here. So we've had our conversations, and now we're going to understand some of the common triggers for behaviors associated with dementia, how to assess their needs, and how to intervene effectively. This workshop will be held Thursday, December the 10th, and we will notify everyone about the time that we will be doing this. And then if you have any questions, certainly give Eric, Brooke, or myself a call, and we will be delighted to help you any way we can. And know that our workshops are always available on YouTube. And if you need a link, we'll be glad to email it to anyone who would like to see them. Eric, do you have any comments before we end our workshop today?
Thank you so much. No, again, apologies for the people that may have tuned in live for this workshop. and we're expecting to see a recording of that. It was technical difficulties, namely me forgetting to record, hit the record button at the right time. So anyway, Cathy, Brooke, and I are always available to answer any of your questions, and we really appreciate your interest and your time in watching our workshop. Thank you very much, and have a good day.